Our guest today is Dr. Susan Margaret Murphy. She is the president of the Drug Intervention Institute, headquarters in Charleston, West Virginia. Welcome, Dr. Murphy.
Thank you. Pleasure to be here.
She has helped develop and implement opioid prescription and medication safety programs aimed at the education of all young people and the public about the dangers of prescription and illicit drug use and misuse. So our topic is opioid pandemic. So let's get into that. Doctor, tell us exactly what the history is of the DII.
Sure. So the Drug Intervention Institute has been around since May of 2019. It was originally founded by a group of individuals who were interested in the impact of the opioid epidemic on the state of West Virginia.
And in the country.
It's
devastating.
Yes. But we first started in West Virginia, and we were initially founded with a generous gift from the Winston-Salem Foundation through BB&T, which is now Truist, and that gift was intended to start the Institute. So when I came to the Institute in May of 2019, it was really just a seed of an idea. I was the very first employee. We had no employees, no programs at the time, and so to see where we've come over the last 5 years is just tremendous.
Well, you have implemented these programs and the projects, but how do you fulfill the mission that you just described?
Right, so the mission of the Institute is to reverse overdose deaths in West Virginia, Appalachia, and the nation. And we really do that, I like to think of it as bookends. So on one end of the spectrum, we have overdose response and the ability to reverse overdoses through naloxone and education on how to use naloxone in our one boxes. And then on the other end of that, we have prevention and prevention education for youth and families. So the goal is that the people on this end never have to need the services on the opposite end of the spectrum.
Well, what is the Don't Keep RX Around program?
So Don't Keep Rex Around is a program that was developed in part to help young persons, as young as pre-K and kindergarten, understand the dangers of sharing medication and misusing medication. And so Rex is actually a talking cartoon avatar that talks to young children and families about the importance of safe medication use, not sharing medication, safely disposing of medication. Obviously, the messaging is different depending upon the age group. Rex is intended to be kind of a snarky character, and so he talks to the kids in real time about the importance of making smart and healthy choices with their medication.
How many people do you think you reach a year with these programs?
We are in about, I would say, 60% of the counties with our Don't Keep Rex Around programming in the schools, but we're estimating we're reaching about 40,000 children and families a year in West Virginia with that program.
A year?
A year, yes.
That's amazing. This is a major, major problem for our country. And I know you've had some help. With the University of Charleston, you've had some programs, and with Murphy Media, which is very effective in what you do. What are the Gold Telly Awards?
Yeah, so the Gold Telly Awards are actually awards that are given to media companies, and it can be for advertising, for PSAs, for film type projects. And we were fortunate in working with Murphy Media to receive a Gold Telly for a PSA that was done on safe medication use and preventing illicit drug use around young persons in high school and college.
So this is media that's doing good stuff like this, not advertising something.
Correct. It's a public service announcement.
Public service. Okay, which is why we're here today.
Exactly.
Okay, so tell us about the involvement and the partnership you have with Charleston in this program, and even Huntington.
Yeah. So well, first and foremost, in addition to the cities, we have a very close tie to the University of Charleston. That is where I started my career. That is where I was the assistant dean at the School of Pharmacy there before I took this job. And we were initially located at the University of Charleston, and then in 2021 moved to downtown. And we've worked with the city of Charleston and the city of Huntington on projects that they have related to overdose response and substance use disorder. And so we have a very close relationship with the mayors of both cities, both Mayor Goodwin and Mayor Steve Williams. So we've been very fortunate to have those partnerships. They've been very, very supportive of our work.
I remember when they started the pharmacy program at UC, I had their first, I guess, director. She was on our show. That was about, well, several years ago, and they've done a heck of a job with that.
Yes, they
So
have.
tell us about the quick response team in the Charleston and Kanawha Valley.
Yeah, so quick response teams are teams that go out into the community after an overdose has occurred. So someone may have overdosed on a Friday, and by Monday, the quick response team goes out and talks to that person and that family, offering them recovery resources, naloxone, and talking them through the process if they wanted to get into recovery. And that team usually consists of a law enforcement official. I know that in Charleston, it's someone from their care office that goes out. In Huntington, they've had people from the faith community go out with their QRT. So these are programs that are throughout the state with most of the counties. And it's really an effort to have that extra touch point after someone has overdosed. It's very hard to talk to somebody who's overdosed in the moment that it happens about recovery, but following up 24 to 72 hours later has been proven effective.
Especially if that person doesn't survive.
Well, usually they go out when it's a non-fatal. So they actually go visit the actual person that overdosed, but they do also talk to the families.
That's fantastic. It's difficult. The public understands if they have this in their family, and there are many families who have these problems, but they don't realize the significance of the entire program and how many other people have the same problems.
Yeah, and addiction is not something that just affects the person who is experiencing it. It really impacts the entire family and that support system that surrounds that person.
Well, having done this now for about 5 years, I think.
Yes.
What are some of your successful projects?
Well, I think Don't Keep Rex Around is a very successful project. We also recently had an article published in the American Pharmacists Association, their journal, on our co-dispensing program. And what that program is, it was in partnership with Fruth Pharmacy and a lot of the independent pharmacies in West Virginia. And the pharmacist at the time of opioid fill at those locations does an opioid screening on that patient and determines whether or not they might be at risk for misuse. If that pharmacist determines that that patient is at risk for misuse, they dispense naloxone along with the opioid, but then also counsel that patient on medication disposal. So we've been very proud of that program. That's a program that we've been able to support through state opioid response dollars. So we've been very blessed to be able to do that for the last 2 years and to have worked to publish a study on the outcomes of that program. I think the other big success for us is the One Box and the fact that, we've been able to distribute over 13,000 of these opioid emergency response kits throughout all 50 states, but we've had reports of 200 lives saved. And so those are just the folks that are reporting back to us. And we've had a lot of significant progress, not just in West Virginia, but in communities throughout the United States. Not only are they saving lives, they're increasing naloxone saturation in their communities. They're increasing the likelihood that someone is going to administer naloxone before EMS gets there. And some of the stories that we're hearing about those reversals are just incredible. And so doing this work, you often hear a lot about death. I mean, that's just the nature of the work.
Yeah.
And so what's been great for me is to hear the stories of people who have had lives saved.
Now, have you had inquiries from other states on how to do what you're doing here, there?
Yeah, we talk all the time about some of the work that we're doing in West Virginia can definitely be replicated throughout the United States, and certainly we've seen that with the One Box, but also have had, conversations with the White House Office of National Drug Control Policy and Dr. Gupta. We've been in situations where we've been at national conferences. The latest one was with Jan Rader and Mayor Steve Williams at the University of Notre Dame. And so we really do talk about how West Virginia really is, even though we know we're ground zero in some ways for the opioid epidemic, we are also the epicenter of a solution, to borrow phrasing from Mayor Steve Williams. And that's really what we're after is, how can we take what's successful here or in other pockets and other communities throughout the country and replicate that? So yes, absolutely.
Well, Dr. Gupta has been on our show several times when he was here in West Virginia and nationally. Now, you mentioned, or I saw the statistic where you had given out 100,000 fentanyl test strips.
Yeah, so we started that work about a year and a half ago, and we've had some funding, although the funding has not been consistent. We decided to stay committed to that through our operations budget, and we've distributed, it's probably closer to 110,000 now in all 55
Who do you distribute
counties.
it to?
So we have a request form online. Anyone can request. So a lot of the folks that are requesting are organizations that are serving the public.
Yeah.
So it might be a recovery center. It might be a shelter or a facility that's working with the unhoused. It might be a parent who's concerned about their child using. Sometimes parents who are sending children off to college will request them. So it's in high demand. And part of that is because, when we look back at this epidemic and the trajectory of it, it really started with prescription pills. And then once those became more regulated, people moved on to heroin. And then what started to happen is we started to see that heroin adulterated with fentanyl.
Yes.
Well, now we're seeing fentanyl adulterating cocaine. It's in counterfeit pills. And so we have a whole subset of people. We still have persons in active addiction that need resources like naloxone and recovery, but we also have groups of people who are not in active addiction, who might be trying cocaine for the first time or taking an Adderall pill thinking they're going to get through a final exam on a college campus, and we're seeing overdoses in that population as well. So those fentanyl test strips are crucial. And then about, I would say 4 months ago, we added to our catalog of services xylazine testing strips. So xylazine is a non-opioid. It is a tranquilizer. It is actually a veterinary tranquilizer. It can cause overdose. Naloxone will not reverse that overdose. So we've started to distribute those as well, and I think we're up to about 7,500 of those in all 55 counties.
Well, the public doesn't realize that fentanyl is a veterinarian and even a human anesthetic. And you can knock out a hippo or a lion or an elephant with small doses or adequate doses of that medication.
Yeah, it's 50 times stronger than heroin.
Right. And the problem is anybody who sells these drugs or gives them out, they may not even know what in the heck they're giving out.
That is correct.
And as far as I'm concerned, anybody that sells or gives out drugs should be put up for potential murder, because if they keep doing that, sooner or later, they're going to cause somebody's death.
And we have seen that in some communities in terms of the law enforcement response, absolutely.
What is the Be the One program?
Yeah, so the Be the One program is actually administered by the West Virginia Collegiate Recovery program here in West Virginia. There's a woman by the name of Susie Mullins, we call herself Susie Squared, who runs that program. And what that does is bring a variety of resources to all of the college campuses in West Virginia. Some of those college campuses have a peer recovery support specialist to support students on campus who might be in recovery. Also, One Boxes are a part of that program. Ally, which is like anti-stigma training, is offered online to students and staff on those campuses, as is a program called SmartRx University. And SmartRx University is I call it the grown-up version of Rex the RX. So it is an actual online asynchronous course that college students can take about how to be safe with their medication. And part of that program is addressing the counterfeit pill crisis and the fact that just because they're taking a medication from someone, they shouldn't assume that it's a prescription medication.
So you're working with the West Virginia Collegiate Recovery Network?
Yes.
Okay.
Yes.
Now, I don't know if you have the statistic. I certainly don't know. But when these kids are sent off to college and they're not still at home, there's more exposure.
Sure.
There's more stress.
Yes.
There's passing. There's the cost of their education.
Sure.
So do you think most of the kids that go to college have already been exposed to some of these drugs, or is it only after the fact?
Yeah, and I think that's why we're trying to focus on elementary, right? Pre-K
Yes.
and elementary, because once you get to, and you know, my husband and I have 6 children between us, between 18 and
God
30.
bless you. He has blessed you.
So we know better. I mean, I think our last one just started college, and the rest are now all graduated. So, you know, my experience has been, and of course I worked in higher ed for 27 years, is that more often than not, if kids experiment, they probably have experimented before they get to college. I think the biggest dangers in college are the counterfeit pills, and that's really what we're trying to tackle. Because, you know, we think that pills that look like prescription medications are seemingly safe, and that's just not the case anymore.
Well, review with us some of the statistics that you all have shown that shows the drug exposure among children 5 and younger.
Yeah, it's the number one reason why there are calls to poison control, is that a child has ingested a prescription medication. And we've seen an increase in, you know, the numbers of children that are overdosing on opioids. Now, that doesn't mean that that young child at 5 is actively using opioids. What's happening is they're getting a hold of something that is in that home, and they are overdosing.
In the medicine box.
It could be in the medicine box, but more often than not, people don't store their medications properly.
They put it by the bedside.
So that's part of our messaging too.
Yeah.
And in West Virginia, we have the largest number in the country of children being raised by grandparents, and a lot of that is a direct result of this epidemic. And so what happens is we take these children from a seemingly unsafe environment where there is illicit or prescription drug use and misuse, and we put them with the grandparents, and we think that's a safer environment, and it is.
But
except grandma and grandpa are less likely to store their medications properly. They're more likely to have multiple prescriptions. They're more likely to have an opioid prescription.
For pain.
For pain. So we have to teach ourselves as adults that we can't leave medicine out on the counter or on a table or even on the bedside table. We have to keep that up and out of reach of children and teach them the importance of doing that themselves as they get older.
So 9 out of 10 unintentional childhood poisonings occur at home.
At home, absolutely. And that is why safe medication disposal and storage is so important.
Well, tell us a little bit about your staff.
Sure. So I have a wonderful staff, and for those that have moved on to other positions, they've certainly added to the success of the Institute as well, and it's wonderful to continue to keep in touch with them. But one of the things we've been very intentional about over the last 5 years is moving toward building a recovery workforce. And so we are at a point now, we used to say 50%, the majority of our staff now are persons in long-term recovery. And we're very blessed because it's very important when you're doing this work to make sure that you're working with people who have lived experience. And it's also important, I think, for the community to understand that recovery does happen. And so that workforce at our institute brings with them a very unique perspective and experience that helps us and informs our work, really, and that is invaluable.
Well, it's the idea that somebody who has been through this understands where these people have been and or what they're going through.
Yes.
And they're proof that you can change your life. You can be positive.
Recovery does happen.
And it's so easy just to pop a pill even if you don't always know what it is, because these youngsters, these teenagers or even adults, if they go out, they should not put their glass down or their cup down, because somebody will put a pill in there possibly and attack them later. You keep the cap on it, you carry it with you, you don't put it on the counter. Is that good advice?
That is good advice, but it's also good advice if you are using drugs to test before you take. And it's also important that everybody get trained on life-saving naloxone so that everyone has the potential to be a bystander should an overdose occur. And you can do that through the One Box. There's a training component in the One Box. But the other thing that you can do is we have an online naloxone course at the Institute. And you can go online and take that course and then receive your naloxone after you've taken it. So I encourage everyone to be trained on how to use naloxone and to carry naloxone. And if you were an employer or a school or a workplace, to consider putting an emergency kit in that facility so that if an overdose is happening, that naloxone is in proximity and you can get to it very quickly.
It's much like the EpiPen for these kids and adults who have severe allergies.
Yes, absolutely.
I figured, yes, okay.
It's like, and the One Box is like an AED. In fact, we encourage people with the One Box to install it next to an AED or a fire extinguisher, so it's easily found and accessible.
The One Box, I mean, the fact that you're training people how to use this and also educating the ones who should have this at home and know how to do it is very important because it is not something that you, well, there's instructions on the packages and all, but still it's important. That also would indicate that if somebody is interested in this, they realize they have maybe a problem in a loved one.
Absolutely. And, I don't think it's just for people who are in active use or people who know someone in active use. I really think everyone should carry naloxone because you just never know. And I think one of the great things about the One Box is it does have the video instruction inside. And so even if someone's been trained, that video is there for them
I did
to
not
watch.
know that.
Yeah, so I'll be happy to just pop one open. It might take me a minute because I think this one might have the seal on it. But as we're talking, I'll pop it open. And I'll be happy to show it to you. So, and we've been very blessed that Jan Rader is the person inside the box. And so we call it Jan in a box sometimes, but it's purple, which is overdose awareness color.
It's also the color of the year.
Yeah, well, I love purple. So it comes with PPE, your gloves, your sanitary wipes, and your CPR mask. Your 2 doses of intranasal naloxone go here. And then if you suspect an overdose is occurring, excuse me, you go to the box, pull out the naloxone, and there's Jan. And that's a 60-second video that talks you through how to administer the naloxone, but also how to put that person in the recovery position, what to do before 911 gets there. A lot of communities across the country love that the video is also available in Spanish. And then
how does one get these kits?
So they are available through the Institute. They are for sale.
In West Virginia.
In West Virginia. And they can go directly to our website and learn more information.
Can they go to a pharmacy and get this?
Not right now. That's a
You're
goal,
working on
goal
that.
that we have. Yes,
yes,
that is a goal that we have, 100%.
Is it proper to ask how much they'd have to pay for that?
Yeah, so these retail at $199, and we're constantly working to try to drive that price down. And so a lot of communities, though, are purchasing hundreds of these and deploying them. So, for example, Nashville has deployed them in all of their live music venues.
And there's 3 in each of these kits?
No, it's intended to hold just 2 doses, and it comes with the 3 PPEs. So that way, it's meant to be reused. So if you've used it once, you just replace the PPE, replace the naloxone, and you're good to go. So it's reusable.
And they can get that at the drugstore, or do they have to go?
Most communities have robust community distribution programs for naloxone. So most communities are getting naloxone for free through their local health department or coalitions.
Yeah, and they put the boxes, public boxes,
Yep.
where you can just go and get. And now, how many of those are in the state now?
We I don't know, in the state it's probably almost 4,000, if not more, but there's 13,000 now across the country.
And in the state, does somebody check those on a regular basis?
Yeah, there's a standard operating procedure that tells the person who has purchased the box and installed it to check it on a regular basis, and there's a whole protocol for that available on our website.
Have we talked enough about Rex?
Yeah, I think we have. I mean, I think Rex is expanding now, I can say that. So we started with pre-K and kindergarten, and now we're moving all the way up to 5th grade, and that's something that's going to launch this fall, so we're very excited about that. I would say we also have something called the Healthy Brain Exhibit, and that's an inflatable brain, and that walks kids. They can actually walk through the brain, and it talks to kids from kindergarten through 5th grade about how addiction impacts the brain and how to keep their brains healthy. And we'll be announcing soon a semi-permanent location this year for that exhibit.
Is that the pre-K and kindergarten program?
Yeah, Rex started as pre-K and kindergarten, and now he's expanding all the way up to 5th grade, yes.
And has that been effective?
Yes, that's the program where we've reached about 40,000 students and families
A
in the
year.
state.
A year.
A year,
That's
yes.
amazing. That's amazing. So, what is the elementary outreach program?
That's Rex.
That's part of it.
That's Rex, yes.
So you're going to educate the parents, the teachers, and even the students.
And the grandparents.
And the grandparents. I forgot. Yeah, I'm one of
The
those, man.
grandparents.
I'm one of those, yes. And the pharmacy schools have been, or the students have been somewhat of a help in some of these cases.
They have. We actually take pharmacy students on rotation from both the University of Charleston's pharmacy program and Marshall's program. And so they come and they work in our office 5 weeks at a time, and they're very, very helpful to us, and we're very thankful to both of those programs.
Are the parents accepting what you're doing?
Oh yeah, I think for the most part, parents understand that this is unfortunate that we need to have this kind of education, but it's necessary given where we're at.
Yes, it's a very difficult position because a lot of people don't want to admit that they have a problem or there's a problem in a loved one.
Exactly.
Many people don't know there's a problem in the loved one, and that's the problems. So is there a system in the school where the school, if they think there's a problem, notifies the parents?
Yeah, I think that's probably county dependent. That's certainly not my area of expertise, but I know there's a lot of mental health coordinators, school nurses, and administrators that have processes for that in the schools.
Well, I want to thank you, Dr. Murphy. Your knowledge about this program is outstanding. Of course, you developed it, but I want to thank you for taking time from your busy schedule and what you have accomplished with the drug intervention program, not only in West Virginia, but in the United States. We should thank the Murphy Media, the University of Charleston, Truist, Huntington and Charleston,
Yes.
The city people, and the West Virginia government for helping you through these devastating problems.
Yes.
Thank you so much. God bless you.
Thank you for having me.
He has blessed you. How many kids?
Well, we have 6 between us.
Now you have been
And 2
blessed.
grandkids,
God bless you, and thank you for taking time to see vital signs. This is Dr. Richard Rashid saying, I hope you see a bright day.